It's a great pleasure for me to be with you virtually in the 18th meeting organized by the Arabic Association for the Study of Diabetes and Metabolism. First of all, I want to express my deep thanks to Professor Ina Sheltout, the President of Arabic Association for the Study of Diabetes and Metabolism, and the organizer for the 18th International Conference for their kind invitation to participate today to this meeting. I would have liked to be with you face to face, but personal circumstances prevented me from doing so. That will be for another time. My talk will concern pre-diabetes management in 2022, and my talk will include the following agenda: definition, prevention and risk factors, high risk factor of progression to diabetes, diabetes prevention, vascular complication with macro and microvascular, and the treatment of pre-diabetes. On basis of 2022 standard of care, the criteria of diagnosis of pre-diabetes and diabetes indicates for all three tests the risk is continuous, extending below the lower limit of the range and becoming disproportionately greater at the higher end of range. In the absence of unequivocal hyperglycemia, diagnosis requires two abnormal test results from the same sample or in two separate samples. For asymptomatic adults, the screening depends on the following situations. Testing should be considered in adults with overweight or obesity and who have one or more of the following risk factors: first degree relative with diabetes, high risk RAS, history of cardiovascular disease, hypertension, HDL cholesterol level lower than 35 milligram, physical inactivity, other clinical condition associated with insulin resistance. Number two, patient with pre-diabetes with A1C more than 5.7 should be tested yearly, and women who were diagnosed with GDM should have lifelong testing at least every 3 years, and for all patients, testing should begin at age 35 years. And if results are normal, testing should be repeated at minimum of 3 years intervals. For asymptomatic children and adolescents, the screening of diabetes and pre-diabetes should be considered in youth or obesity who have overweight or obesity, and who have one or more additional risk factors based on the strength of their association with diabetes, maternal story of diabetes or GDM during the child's gestation, family story of type 2 diabetes in first or second degree relative, race, ethnicity, sign of insulin resistance, or conditions associated with insulin resistance. And after the onset of puberty, after 10 years of age, whichever occurs earlier, if tests are normal, repeat testing at minimum of 3 years interval or more frequently if BMI is increasing or risk factor profile deteriorating is recommended. We see the continuous glucose monitoring in healthy person, and this woman 26 years old, which with HbA1c 5.2 is typical snack eater, and prediabetes starts with glucose pinks. This man 61 years old with EGT and HbA1c 5.0%, increase in fluctuation leads to increase in oxidative stress. As you know, the story in the story of prediabetes and diabetes, some of disorders begin before the beginning and the diagnosis. Visceral obesity, free fatty acid, and hepatic fat. Secretion of proinsulin and insulin is growing and begins declining at the diagnosis of prediabetes and secondary with diabetes. What about prevalence and risk factors? As it was announced by IDF and different international studies, the prevalence of diabetes and prediabetes is increasing highly in MENA region, with WHO result and in Atlas IDF in 2019 in 9 edition, and also in Atlas IDF 2021 in different countries. The big problem is that that prediabetes leads to diabetes, and it's known that the most individual, probably more of 70% with prediabetes state, will develop diabetes, and the transition from impaired fasting glucose and impaired glucose tolerance to diabetes may take many years. What about the prevention? The diabetes prevention program have shown for a long time the importance of lifestyle. According to this program, metformin have reduced the incidence of diabetes by 32%, lower than lifestyle, which reduced the risk by 58%. And the same result were observed with US and Finnish study in 21 and 22. The efficacy of the lifestyle is also demonstrated in the meta-analysis with different studies. What about the long-term impact of these studies? For long-term, the impact of lifestyle is real, and as it's shown by different studies. Now, what can we say about vascular complication, macro and micro complication? Is prediabetes associated with increased vascular complication, especially cardiovascular risk? Is treatment of prediabetes associated with improvement of this risk? In this meta-analysis with 18 studies, both type of prediabetes condition, EFT and EGT, increased the risk of cardiovascular disease. Also, prediabetes is associated with increasing risk of nephropathy, neuropathy, and retinopathy. With retinopathy, persons with EGT have an approximate 10% incidence of diabetic retinopathy. Prediabetes, like over to type 2 diabetes, is accompanied with high risk cardiovascular. Patients with EGT and or EFG should be aggressively treated to correct cardiovascular risk. Does the clock of coronary heart disease start thinking before the onset of clinical diabetes? In pre-diabetic individuals may have an heterogenic pattern of risk factors even before the onset of clinical diabetes. This may explain the relative lack of an association of macrovascular complication with either glycemic severity or disease duration. And 614 initially non-diabetic persons participate in an 8-year follow-up of the San Antonio Heart study, and the result of this study indicate that pre-diabetic subjects have an heterogenic pattern of risk factors, and these risk factors may have been present for many years and may contribute to the risk of macrovascular disease as much the duration of clinical diabetes itself. And the Euro survey on diabetes and the health in 2004, the prevalence of abnormal glucose regulation in patients with coronary artery disease across Europe, it showed that 20 to 30% of patients with coronary artery disease present with newly detected glucose intolerance or diabetes, and nearly 70% of patients with acute myocardial infarction and no previous diagnosis of diabetes show either EGT or diabetes. And in Eurospire, the European action on secondary prevention through intervention to reduce events are large cross-sectional surveys across Europe of patients with coronary artery disease to evaluate the adherence to joint European Society's prevention guideline, and in Eurospire for a cross-sectional survey of 4,004 patients with no reported story of diabetes had fasting plasma glucose, 2-hour plasma glucose, and HbA1c measured. And in this study, respectively, regarding WH criteria, only 26.6% and in other 10.5% have normoglycemia. It's important in prediabetes to add that long-term consequences include increasing of hypertension, increasing of risk cancer, and increasing of risk Alzheimer's disease. The question now is treatment of prediabetes associated with reduction of cardiovascular risk. In the STOP NDDM trials, diabetes care in 1998 showed that acarbose of prediabetes was associated with significant reduction in cardiovascular endpoint. And the meta-analysis in New Journal England at 2002 demonstrate that both change in lifestyle and administration of metformin can prevent diabetes and can significantly reduce cardiovascular death, ischemic heart disease, and stroke. And the fact that cardiovascular disease appears early in the course of glucose metabolic abnormalities requires earliest diagnosis of these abnormalities and preventive strategies as firm and aggressive action against all the risk factors of vascular disease, especially those associated with increased atherosclerosis and cardiovascular risk. And in summary, we can say that prediabetes is an important risk factor for future diabetes and cardiovascular disease. With risk of prediabetes is continuum. Important to identify early and begin intervention immediately. Interventions can reduce the rate of progression from prediabetes to diabetes, including also healthy diet, physical activity, and weight loss. What about treatment of prediabetes? What treatment strategy improve outcomes in asymptomatic adults with prediabetes? It's sure that lifestyle modification, Mediterranean diet, and using metformin are good things for treating the situation of prediabetes. In European Society of Cardiology, the lifestyle in diabetes and prediabetes was recommended class 1 with level A as smoking cessation and reduced intake of calories. And also physical activity was recommended class 1 with level A. And what are the characteristics of successful lifestyle intervention? Now, first is intensive with small group and for 6 to 12 months, extended to only minimum 2 years, multi-component with reduced total intake, reduced FIC intake, exercise, increasing fiber intake, and strongly integrated behavioral principles with moderate weight loss, 5 to 7 weight loss, and for long term, 3 to 4%. It's sure that life modification and regarding physical activity is very important for adults, especially minimum of 150 minutes every week. And we evaluating patient for contraindication, prohibiting certain type of exercise before recommending exercise program. And for children with prediabetes or diabetes, exercise program should include more than 60 minutes of physical activity every day. The consequence of regular physical activity is improving the insulin sensitivity and physical and fasting insulin, as it was demonstrated in the ERA study. The position now of metformin in the treatment with patients with prediabetes and type 2 diabetes in 2022, metformin is used either in monotherapy or in free or in fixed combination with all available drugs. Metformin has unique properties, perfect drug for prediabetes, powerful HbA1c lowering effect, reduces weight, no risk for hypoglycemia, anti-atherogenic effects, reduces macrovascular complication and CVD death, reduces incidence of and mortality of cancer, and metformin is also inexpensive. And in 2022, metformin is the leading drug worldwide, and this will continue, and probably no change until the 100-year anniversary in 2057. Regarding diabetes and obesity, the quality of life drives adherence. So importance of convenient therapy and behavior change is necessary for effective therapy with high involvement of patient. Those identifying prediabetes in asymptomatic overweight or obese adult lead to better outcomes than delaying the diagnostic until the onset of symptom. Yes, and it's opportunity to intervene and prevent diabetes and its complication. In conclusion, I want to underline the importance of the diagnosis of prediabetes, the high prevalence of the disease, which is not well recognized. It's an important risk for future diabetes and cardiovascular disease. Risk for prediabetes is continuum. Important to identify early and begin intervention immediately. Interventions can reduce the rate of progression from prediabetes to diabetes, and therapeutic strategies and challenges of the adult and the children should include healthy diet, physical activity, and weight loss. And at the end, I would like to inform you that the Moroccan League for the Fight Against Diabetes stands out in New York during the 77th session in the United Nations General Assembly. This award, which concern prevention and tax soda, realized in Morocco for the prevention of obesity, prediabetes, and diabetes, is honor not only for Morocco, but also for all MENA region. Thank you for your attention.